I am Dr. Madhuri from India, and really nice to have all of you here, and especially amongst all the beautiful people of Paris, France, and other part of the country. My topic for today will be the combination of radio frequency along with a platelet-rich fibrin. So how effective it is going to be for the facial rejuvenations and the scar treatment in Indian scenario. So let's just go quickly in detail about what exactly is skin rejuvenation. So basically, we want everybody to be relaxed with the fine lines and wrinkles disappearing, and also to have a good skin and texture. So but this also includes the photo damage. So rejuvenation includes tackling all these problems. Now, there are many studies and researchers which have done, which make sure that the skin damage, and it also affects the mental health, and there are multifactorial. These are some of the researchers that impact, and obvious aging can bring down the self-confidence in a person. Now let's go in detail about how this happens. Initially, it was just the laser, which was used for the skin rejuvenation. Forwarding, there was radio frequency, which came inside, and the microneedling also played a major role in developing the skin rejuvenation. So basically, what it does is we are going to create the injuries to the layers of the skin, and it results in collagenesis, but obviously there was an amount of downtime. Now, what about combining both of them? Now, both of them includes the radio frequency and the microneedling. Now, that's when it emerged, the microneedling radio frequency. As we all know, the microneedling MNRF is insulated and non-insulated. So basically, these types of insulated is the energy is released just at the tip of the needles. The non-insulated is the energy is released throughout the length of the needle. So basically, when these needles are penetrated inside, you have the damage from the top layer to the area where we are trying to target. So there are some studies which have done that the insulated ones have better result with minimal of the damage to the upper layers of the skin. Now, this is a small video of how exactly this works. These needles are basically coated with polymer, and these are gold-plated needles, and these have better penetration into the epidermis because there is protection and there is no damage to the first layer. Now, these needles go up to the depth among like what we want the depth up to. Say example, we want up to 2 mm, we can fix it up to the 2 mm. The energy is released, and there will be the induction of the energy, post which the injection of liquid PRF was done. So, and they will be healing after the procedure. So basically, this video gives an insight about how this works. Now, coming to the platelet-rich fibrin, quickly, everybody knows what are growth factors and how PRP works. And I would want to mention that in comparison with PRP, PRF works better because the growth factors are quite active, and the number of growth factors are quite high. So this is a small video just giving you a gist about what goes inside the platelets, because platelets also release some derived growth factors which are helpful for healing. And also, there is a very important growth factors called vascular endothelial growth factors, which is really important for any neovascularization and also collagenesis. Just about what's the difference. The fibroblast move more faster in the fibrin because it's very active. PRP takes quite a long time for processing the whole thing, but PRF is quite quick processes, hardly some 3 to 4 minutes. And overall, I would rate the fibrin to be more effective than the plasma. We can definitely consider using it. So in my study, I have chosen 30 of my patients from aging between 25 to 60 with primary concerns of laxity, fine lines and wrinkles, and double chin, acne scars, and post-traumatic scars, and also for minimal of aging signs. My procedural steps includes topical anesthesia, forwarded which 3 passes of microneedling radiofrequency, after which the platelet-rich fibrin liquid was injected and also topically applied. Post-procedure protocol was strictly followed, and it was common amongst all my patients. Right. So this is a small video of the procedure, how we do. So basically, we draw the blood, and this tube does not contain any kind of anticoagulant. So it's anticoagulant free. The blood is drawn, and it is centrifuged. And the centrifuge parameters are 800 rotation per minute for 3 to 4 minutes. So this is how it, and this is the fibrin which is in liquid form. And we gave the injection in retrotracking method and a fanning technique, and also we gave supradermally. We also injected in the area which required a lot of improvement, and we sprayed the liquid PRF on the skin post the radiofrequency. Now, the main reason why we try to choose the fibrin is it reduces a lot of erythema and the redness post the procedure. The strict protocol was followed, and hardly the regular paracetamol was given if there was any discomfort, which is SOS, and a moisturizer along with a lymphatic drainage. It's for the only patient which required a double chin improvement. This is one of my patients with immediately after the procedure having almost no downtime, in the sense almost no redness. And let's go in detail about my patient. This is one beautiful lady with coming up with a complaint of scars. So this was before, and this is how the scars appeared after 3 sessions. And she was one of the favorite client of ours because she was very, very happy with the result. Yes. So this is another side. Not only the scars, we could also see improvisation over the acne and the texture of the skin. It looked more better than what she was before. So this is another for the anti-aging. This was quite drastic for us to believe that radiofrequency energy goes actually very deeper. We could actually see some infraorbital changes, in the sense like the rejuvenation in the infraorbital region. We could see some changes in the nasolabial folds, which is quite evident, and the marionette lines. It looked like this was very quick. As a result, we weren't even expecting so fast result in such a patient, because she was quite old than the previous patient. She comes under the category of the aging, actually. So even here we also saw some changes with the scars. Her texture of the skin also improved a lot. Another case of mine where we see good improvisation in the periorbital region and the nasolabial fold looking more smoother and subtle. And this is how whole the texture of the skin and the skin tone improvised a lot. And this is another client of mine where we had done combined treatment along with this, where we did a little bit of lip fillers. Other than that, the other parts of the face wasn't touched. It was only radiofrequency and liquid PRF. So as we all see, the pre-jowl area, it looks excellent. The jawline was more accentuated. The nasolabial fold looked really good, and she's one of my happy patients. So this is enough. We try to accumulate a lot of patients of different skin tone, different texture and color, and we see the diversity in India. So this is the periocular region rejuvenation, quite evident, and even the nasolabial, as well as we can see a good texture skin tone on the jawline area. And this is a little older patient where we very, very much appreciated the nasolabial fold looking more subtle and smoother. The aging signs were looking lesser, and also there was lipolysis in the area, like there was the fat prolapse. What we see was actually looking subtle and smoother. And we also noticed that there was the neck laxity, or what we call as the laxity in the double chin area, which looked lesser. And of course, the marionette lines that made a lot of difference. We also have done even male patients where this particular patient had come with a complaint of the double chin. So, like I said before, we also did the lymphatic drainage post the procedure to make sure that there is a proper lipolysis and excess of edema is removed. And as we all know, with any energy based devices, we generally encountered a lot of edema, and also we were injecting the platelet rich fibrin in the liquid form. So here we see, and this. And unfortunately, this person, we just did only 2 sessions. It was not a 3 sessions complete. And this is another lady with a good rejuvenating changes. And we could appreciate a proper, beautiful jawline, which was looking very evident. And this patient had come up with a complaint of skin rejuvenation based on the pigmentations as well as the tightening and the aging signs. We did a combination treatment for her. We also considered using the Cosmelan treatment for the pigments. However, the platelet-rich fibrin also helps in the pigment, but we did not consider that for our study. This is how she looked later. There is a lot of difference between before and after, which is quite evident. And we also saw the jowl and the marionette lines looking smoother, and the texture improvement was definitely there. And even the double chin area, there was a lot of difference. This is another lady with the similar effect. This is how she looked. So we want to combine the radio frequency along with platelet-rich fibrin basically to improve the texture and also to improve the wrinkles and fine lines to diminish a bit. However, we also noticed that there was some lipolysis and changes in the fat in the area where we could decrease it, especially in the double chin area. And it gave a tighter and rejuvenated look for almost all my patients without any complaint. The main reason why we really wanted to include the fibrin is to reduce the amount of redness downtime. There are many of our patients who come down with energy-based device requirement, and we end up giving a lot of redness post-operative, and we would want to focus on that to reduce, because we always say lunchtime procedure and a quick procedure, and but definitely somehow somewhere I agree that we give the redness which persists for 1 day, 2 or 3 even, and we also give the post-operative steroids and topical applications, etc., and this can be an alternative for those. And the key points, it has lesser downtime. As I said, the healing is very, very faster, and the processing of the fibrin is quite not as much as plasma, because plasma probably will take more than 15-20 minutes, and sometimes if you're inducing the growth factors, you're including that will take extra time of maybe 10 or 15 minutes more. So it's a minimal damage to the skin surface, and at the end basically we want all the rejuvenation with minimal of the downtime to make the process whole lot quicker. So thank you very much. It was really nice having you here.